Hello, and today I'd like to talk about the relationship between nasal breathing and asthma. And I'd like to, of course, discuss a little bit of Patrick McKeown's book, um, which is called Oxygen Advantage, because I think our breathing is so important. Again, we can live for days without food, literally for hours we can live for like a month or so without food, for days without water, but only like minutes, right? Um, Without air or without oxygen. And so I think learning how to properly breathe is very important. And specifically here, I'd like to talk about the relationship between proper breathing and asthma symptoms. And so Patrick McKeown in his book mentions a person called Julian who had asthma and was prescribed medications and went to the hospital for help. But after he was taking higher doses over time and higher doses, and after, it didn't really help him much, right? These medications and hospitalizations only made it actually worse, making him even more reliant on these medications and treatment. And so many people actually even avoid things like physical exercise for asthma just because it feels uncomfortable, but it can actually be beneficial, specifically how you do it, as we'll talk about later. Now, after trying nasal breathing and doing things like breath hold walks, Julian, which is one of his clients, didn't even need his reliever and preventer medications anymore and literally stopped taking it after 6 months after doing the Buteyko breathing strategies like reduced nasal breathing. And this was all in 2007, and in 2008 his family doctor actually reclassified his asthma as being solved, and his fitness greatly improved, and he was able to return to high intensity cycling and even run like marathons. So what did he do? So first of all, exercise-induced asthma affects 4 to 20% of the population in the US and causes difficulty of breathing during exercise, because what happens is your airway gets narrowed or gets constricted, and it can lead to symptoms like coughing, wheezing, breathlessness, and even chest tightness. And some hypothesize that it is caused by not getting enough germs, causing a weakened immune capability, or that it is caused by poor air quality that can also trigger asthma, such as pollution, for example, right, in the air, and we're breathing it in. However, as early as the 16th century, ancient Greek physicians were actually recommending breath hold and breathing exercises that we'll talk about today, and it only makes sense to address the breathing because asthma is a breathing condition. So addressing the breathing is definitely important to address asthma, because asthma is a breathing problem. Now, what has been shown that right now higher wealth is actually not necessarily associated with with health, right? More wealth, people who are richer, people who are getting more money, are actually people who are more likely to get asthma because they have a lot of things that are in common. They have higher processed food consumption, higher stress levels, and lower physical exercise, and a very sedentary lifestyle, for example, at work, right? Like a desk job, for example. So you can start here and actually get these factors fixed first. Eat natural food, have less competitive stress or stress in general, and get some physical exercise, because all of these three things can help you reduce asthma. But why is that? Remember, all of these things actually help reduce breathing volume. We know processed food is acidic, so we tend to breathe more to exhale all the CO2 acid to maintain normal pH levels. So eating acidic food leads to overbreathing and a higher breathing volume. So is stress, as we saw previously, stress and being obese, right? So getting little exercise and being sedentary can cause that, and stress and being obese can also increase breathing volume, and as we saw previously. So that is why this relationship is true. People with asthma literally breathe 2 to 3 times more than the normal amount, right? Which is, they literally breathe at 10 to 15 liters versus the normal amount, which is only 4 to 6 liters a minute. Normal breathing should be via the nose and silent abdominal breaths, but asthmatic individuals tend to be habitual mouth breathers and use their upper chest more often. As the asthma situation becomes worse, breathing volume only tends to increase, and it becomes a vicious cycle. Why do they breathe more, you may ask? Because as the airways become narrow, they have a sensation that they need to breathe more, so they try to eliminate that sensation, so their breathing rate only increases, and that can lead to hyperventilation, for example. So this causes a vicious cycle as they breathe more when their asthma actually gets worse. So it's like they breathe more while their asthma gets worse, so they want to breathe even more, and their asthma gets even worse. So the severity of the asthma only gets worse and worse as the breathing volume goes up. And this is a cycle, right? Whereby our influences of modern life, like stress, for example, or eating processed food, or being overweight, or what have you, can cause a higher breathing volume, which leads to a loss of CO2, which, because we exhale all of it, so we get a reduced CO2 tolerance. And this causes a constriction in the airways, right? We saw some other benefits of nose breathing, like increasing blood flow and all that. But if you breathe with your mouth, and if you overbreathe, you actually reduce blood flow to the heart, like we saw last time, but you also constrict your airways. So you get poorer respiration. So you're not only your heart function or cardiovascular function decreases, as we saw previously, but so does your respiratory function. And so you get a constriction in the airways, which causes further poor breathing habits. Because now that your airways are constricted, you want to even breathe even more, because you have more of a hunger for air. Okay? Now, research and many studies actually show that reducing breathing volume caused an improvement in asthma symptoms and a reduced need for preventer or reliever medication. How great. So simply by normalizing breathing volume is effective to reduce asthma symptoms and preventing mouth breathing, even though you want to do it as a result of a narrowed airway. So it's better to kind of do not what your body wants, but switching to reduced volume breathing and restricted breathing, such as nasal breathing, to reduce the breathing volume, as that has been shown to improve asthma symptoms. Now, mouth breathing is also not effective for filtration, humidity, and temperature control of the air that's coming through. Also, you're reducing that carbon dioxide, so you have reduced CO2 tolerance because you exhale all of it, as well as reduced nitric oxide levels in the blood. So it reduces lung function and contributes to asthma. And research actually shows that nasal breathing during exercise also helps with exercise-induced asthma. So not only doing it at rest, but doing it while you exercise can also help improve asthmatic symptoms. Now, Patrick noted that swimming is a great sport because it involves breath holds, and swimming underwater is good because you actually get higher carbon dioxide tolerance. So you have higher CO2 levels, as well as you produce more nitric oxide and you reduce your breathing volume. That's why swimming and like things like water polo are better for improving asthma symptoms than other sports, like high intensity sports that require you to breathe, that cause you to breathe through the mouth, and that don't have those breath hold component integrated into them. And so breathing light and simulating high altitude areas can all improve both score, as we saw last time, right? So using your nose to breathe and breathing lightly, and they can actually give you similar results that swimming does. In fact, a both score of 20 can show an improvement in asthmatic symptoms, and a both score of 40 can completely reverse asthma, can completely eliminate it. And this is good because, especially since chlorine has a negative effect on lung tissue. So if swimming may not be an option, although it has the benefits, unless you can find an ocean or a lake, breath hold is freely available and accessible to everyone. It's a good method to improve your BOLT score and reduce asthma symptoms. Now, Patrick gives an exercise, but suggests that you talk to your family doctor if you can't stop your asthma symptoms in 10 minutes, as the symptoms tend to worsen over time. To stop the symptoms before they get worse, he suggested to do the following. activity or exercise. You want to take silent breaths via the nose and out of the nose. So breathing only through the nose, in and out, holding the breath for around 10 to 15 paces, waiting for 30 to 60 seconds. And when you wait, you want to breathe via the nose, and then you repeat, continuing the breath holds for 10 to 15 paces and resting for 30 to 60 seconds while nasal breathing, and doing that for 10 minutes or more. Now, if you have mild asthma symptoms and if they're not too severe, you can hold your breath for more than 15 paces if you like. So he recommends doing this exercise for 10 or more minutes. Now, he also recommends, so as we mentioned, he recommends these breath hold walks to warm up. So in addition, by the way, to this exercise, he also recommends things like breath hold walks to warm up before beginning to exercise with asthma for around 10 minutes. So that's where you literally hold your breath, I don't know, every minute or so as you walk until you get a moderate to severe air hunger, right? And that can be a good strategy as well. And then you want to increase the pace over time. So you can do, like, as a warm-up, a fast-paced walk, where you hold your breath until moderate air hunger every minute, and you can do it for like 10 minutes at a time. And then make sure to also cool down at the end to recover your breath. So these exercises, the warm-up and the cool down, and the exercise that I provided earlier involving breath holds, in addition to, of course, breathing through the nose and reducing your breathing volume, are all very effective strategies to reduce asthma symptoms.